Welcome back. This is the Arise News Channel. You're watching the morning show with me, Toyosi Phillips.
And me, Labo Daniel. So now we'll have a quick chat with a consultant at Reddington University, with a consultant at Reddington Hospital, and Dr. Deen, and we'll just be having a chat about the medical news. So welcome to the studio.
Welcome to the morning show.
Thank you both.
Now, we'll just start with a few of the stories. So let's start first with the pregnancy breakthrough. So there's this recent pregnancy breakthrough that has come about, and then we've been told that there are going to be less women who would have miscarriages. And what are your thoughts on this?
Okay, as with all research, you need to be very careful how you interpret what you're hearing. The research comes from a reputable journal. It's called the New England Journal of Medicine. However, what the news item doesn't say is that the vast majority of miscarriages, as far as I can remember, are actually due to congenital abnormalities, which means that the fetus is defective. So nature aborts it naturally. The obstetricians might want to correct me on that one. But that doesn't remove the fact that there might be reversible defects which are open to treatment. And yes, the research on its own merit is useful, but I think it is probably slightly, it's a slight misunderstanding of what, I haven't read the paper myself, but it's a slight misunderstanding to think that just based on what they found, there'd be a dramatic cut. I think we need to take on board the fact that there's more than one cause of miscarriages, and that is the way I'd interpret it, that it is one useful piece of kits.
Information. So essentially you're trying to tell us that anything we read in medical journals, we should always look at the fine print.
Because there seems to be different, like one journal says this and then another journal says this. So how would you advise like regular non-medical human beings to garner their news on breakthroughs in medicine?
Right. I think the useful way to look at medical research is always to, by all means, read the information, but ask an expert for the real interpretation in terms of what it means for treatment and how it impacts on the individual concerned. It's like we all fly in planes. I'm sure you can download something on the internet on how to fly a plane, but I don't really think you'd go into the cockpits on British Airways or Emirates. So that's the way I'd look at it.
Okay, we also talked about the cholera outbreak in Yemen, which is really sad because they seem to be at war there as well. And I was reading something that said cholera is more prominent in countries that have severe poverty and war and all of that. Now, what is one thing that can, I mean, they're there already, they're in the middle of the war, it's not caused by them, but what can they do in terms of preventing this outbreak from spreading? Because about 500,000 people have been affected.
Right, so if you go back to the news item, the person concerned was Priti Patel, who's the International Development Secretary in the United Kingdom. Now, when you hear anything come from the International Development Secretary about a third world country, it's almost beginning to raise red flags about the possibilities of states that are in trouble or failed states. To me, this is simply an index of failed state syndrome. A country that's been at war, the infrastructure is broken down, they probably don't have potable water, and therefore the water they drink is probably contaminated with possibly sewage, and that probably is the background to this story. What can they do? Well, we need to get, in the developing world, we need to get countries functional. States need to be supported to have working governments, and those working governments need to deploy facilities in their countries to provide social services that will allow people to have a meaningful life. This is, as far as I'm concerned, just a symptom of a failed state.
Right. Okay, great. Now, again, there was something at Yale University where they had talked about people who use alternative medicine being more likely to die from cancer than people who actually use the right medicine. Do you have any thoughts on this recent research? Or is it still back to what you had said earlier on about looking at the fine lines when people come up with new research?
Again, yes. Primarily, I think we should start from depending on what stage of cancer we're talking about. So a lot of cancers which once upon a time were death sentences are now auspiciously treatable. Once upon a time, breast cancer was a killer. Once upon a time, colonic cancer was a killer. A lot of those things now, when they're caught early, are actually treatable. Now, there are cases where people, young ladies or women, come in with breast cancer for alternative therapy, when in fact what they've been offered is frontline treatment, which could be anything from removal of a small section of the cancer to, depending on what the surgeons or their physicians advise, which may be to take out the breast as a whole, or in fact in some cases, if they're at very high risk, take out both breasts, for example, if they've got a very high risk. Now, that is not necessarily something that a young lady wants to do, because there's an element of femininity in keeping part of your anatomy. So they might choose to go for alternative therapy, which is, I don't know what the evidence is, but on the strength of what I've seen, I don't think it is tested. It is tried, but I don't think there are any studies that show 1,000 women with breast cancer were given seaweed water, for example, and 50% of them were cured. So you're comparing something where we know the limitations of conventional medicine. We know what treatment works, at what stage it works, at what stage it doesn't work, with something where you get your seaweed water or your holy water, depending on what's your, and it works for everything. That's tried, but it is not tested. The alternative is conventional medicine, which is tried and tested, and we know the limitations of. We know when surgery will not be an option. We know when chemotherapy is not the ideal option. We know when radiotherapy is not the ideal option. So I'm not really surprised by the research finding.
Shouldn't more attention be paid to alternative medicine? Seeing that, I mean, generations before us were living off bark of trees and drinking bark of trees and getting healed, but they were not educated enough to actually make notes, and so we couldn't have followed the process. You know what I mean? So shouldn't more attention be given to that?
Well, I think a lot of attention should be given to it. I think the attention should not be it should not be blind faith, because medicine is not blind faith either. I mean, conventional medicine is not blind faith either. When you get a new drug, you would often carry out quite robust research, testing it against what we call placebo, for example, which is something that's a dummy drug, or even conventional drugs that have already been used for the same purpose. And it is only where you can demonstrate equivalence to established medication, or in fact advantage, that you would get significant licensing and buy-in from the medical community. And I think the same should be done for alternative medicine. Now, on the very valid point that you make about barks and leaves, a lot of the medication we use come from barks. Well, historically. Digoxin, which is came from barks. Quinine, as you know, comes from plant. It's a medicinal extract from plants. And historically, for example, in London, they had what they call the London Botanical Gardens. And as far as I remember, those botanical gardens were there. One of the reasons was they could extract medicinal plants from those botanical gardens, which then fueled a lot of the research that's led to the conventional drugs that we talk about.
Interesting. And still talking about medicinal plants, 30 hectares of land were donated to FUNAB, that's the Agricultural University in Abeokuta, but they're focusing on diabetes. So they're trying to get all the plants that can heal and cure diabetes. What's your take on this?
Yes, I think it's a very welcome development. I think the taste of the pudding really would be, we actually have an end-to-end policy. So yes, we're cultivating land and cultivating plants, but is there going to be funding to see the research through? is the research, are we going to be able to develop the drugs? Or if we can't develop those drugs locally, are we going to be able to partner with, for example, developing countries like India, where it is cheaper to make drugs, and therefore the drugs translate to being affordable to people here? Because there's no point developing a drug which people cannot pay for.
But the question then is, at what point, because for me, and I mean, this is me just being a normal citizen who is not in the medical background, is because I think that the reality is a lot of times we wait for other countries to do everything for us in terms of medical interventions, in terms of research, in terms of so many things. So don't you think this is kind of like at least a step in the right direction somewhat, where we're kind of controlling our narrative just a bit more? Now, whether or not, again, as you've said, whether or not we are successful with it, should it just really be said that at least we tried and we're doing something as opposed to just sitting back, relaxing and waiting for the West to do everything for us?
Well, I agree. What I do think is that we're at a stage now in our nationhood where we either accept that we have to take responsibility for ourselves, or we play Russian roulette with our future. And, well, if you play Russian roulette, you get what you get out of it. I really do feel that increasingly we must take responsibility for ourselves. And I think it is multifaceted. It's not the one thing. It's many things. It's primary care. So really, healthcare at the primary care level, preventive medicine, because the cost of admissions and hospital medicine and doing investigations is colossal. And that is not what we need. What we need is addressing problems preemptively. So
essentially we're putting the cart before the horse.
Well, no, there is no cart, there is no horse.
Okay.
Or we go cart and horse. Yeah, so the approach has always got to be multifaceted. In the developing world, or in the developed world, primary health care is big in the United Kingdom, but it doesn't remove the fact that you've got a robust secondary care level, you've got a robust tertiary care level, and you've got robust research. So it's everything. And we also, the only things that in our case, because of the cost and the fact that we don't produce a lot of these things locally, we must really turn our eyes to primary care and prevention.
Right.
Okay, thank you so much for that. We'll be right back after the break, where Dr. Deen will be telling us all about diabetes and so many more things. Please don't go away.